Hi, everybody. It's Dr. Clark, and I wanted to say hello and welcome officially to the course with this video now that you've had a few days to kind of look around and know the ropes of the course. So, in general, there's four components of this course that you're going to see that how you're going to earn your grade. So, essentially, you've got your quizzes, you've got five discussion boards, and then you have two major papers. You have a technology paper, and then you also have an electronic health record paper as well. And so each of those four components comprise 25% of your overall grade. So again, it's really important because every single piece, can make a big difference. So a couple of key things that I want you to make sure you go through if you haven't had a chance is make sure you look at that course syllabus. You understand how you're going to be graded. You're going to look at your rubrics, particularly for your discussion board posts. So your initial post is always due the Thursday of that week with two follow-up peer discussions or responses due on Saturday. I do that for a couple of reasons. That's because we want you to get in and make an initial post early in the week so then your peers have enough time to get in, read, and really give robust responses. What you're going to want to familiarize yourself with is also with APA. You want to make sure that on your discussion board posts and on your responses that you're supporting your opinions or stances with references from peer-reviewed journals or maybe the textbook, and you're not only using in-text citations, but you're also putting references down. And again, that's both for your initial response and for your peer responses if you want full credit. So I just don't want you getting in there and saying, hey, yep, that was good. Or this week, yep, I understand that. I want you to actually put a lot of effort into those discussion board posts. And again, remember your discussion board time really takes place of your in class seat time. So if we were sitting in a traditional classroom, we're conversating back and forth. That's how we're getting, that time in, that seat time. So it's really important that those discussion boards are pretty robust. In addition, there is an Ask Dr. Clark discussion board forum that I want you guys to utilize. If you have any questions related to the week, the content, assignments, those types of things that other students can benefit from, please use that discussion board forum because I'll check that every day. If you have a question of a more personal nature, you can always send that to me via email or you can give me a call. And really, moving forward as you go through the course, what I want you to really gain is just a really basic but an appreciation for nursing informatics. So we use a health informatics book, a healthcare informatics books, because we look at this from a very interdisciplinary approach. We know nurses have a huge role in informatics, but we know that we can't do it alone. And informatics from maybe 20 years ago, right, has vastly changed the role of the nurse. They're now looking at more advanced practice nurses to take on the role of the informatics arena or area. So again, I love informatics. I have a huge passion about it, and looking not only at the electronic medical record, but how we have other systems that integrate into that electronic health record. Private messaging between patients and providers, telehealth technologies. There's a lot that goes into the realm of informatics. And again, all of these technologies, these tools are used, in fact, then to change perspectives of healthcare providers, integrate into their practice, thus to improve patient satisfaction, patient outcomes, and comorbidities. So, as we move along in the course, one of your larger papers is that EHR project, and that's going to be basically you thinking about, okay, if I was the chief information officer, how would I roll out this electronic health record? And you're going to get pieces along the way in the course on exactly how best to do that. Your emerging technology paper is looking at a new technology and how basically that has impacted, patients and healthcare. But not only that, but how is it affecting you as a healthcare provider? So, lifelong learning, what is needed with that technology to make it very successful. So it's a great class. It'll move really quick. Your quizzes, the first three quizzes will be your traditional, multiple choice kinds of questions over the text. And then quiz 4 and 5 will move more into a written short form response and a little bit more laid back because again, I like to give a little bit of variety on how I give assessments. So I know some people feel a lot stronger better, with writing where other people don't. And so that's why I like to mix it up. So I hope you all have gotten into the class. You've looked around. The biggest thing that I want to make sure is that I'm here to help. I know some of you, this is your very first course at St. Joe, and so we want to get our feet wet and do it right. If you have any questions, remember that I'm always just a phone call or an email away, and I'm here to make sure you have the best experience in the course. So again, let's gain a greater appreciation of healthcare informatics, and let's get started. Thanks, guys.